Yeah, perfect. Thank you. Sorry, I'm using a new mic because we had some background during testing. So glad we got that sorted. Thank you for having us. We are very happy to be here today, and I am very excited to be the one to introduce May Chang. I've worked with May for several years now, and she is truly a mentor and an honor to get to work with. So thank you for that. For those of you who don't know May is actually an executive, spent 25 years in healthcare. She has been in several senior leadership roles in very large community hospitals as well as major multi-site hospitals. She's currently the principal of May Chang Consulting, offering these executive learnings to other leaders around Canada. So prior to starting her own consulting firm, and where I was lucky enough to meet May, was she was the Executive Vice President and Chief Administrative Officer at Markham Stouffville. Fantastic hospital, I must say so myself. It was in my old neighborhood. And she's strategically created and promoted the Office of Innovation and engaged partners for an IT hub that successfully mentored upcoming executives. As I said earlier, May is all about mentoring and growing her people. May is sought after for her sound financial planning, fiscal expertise, and she is renowned for her ability to help organizations become financially successful. Prior to joining Markham Stouffville, she also served as the interim chief executive officer at Shared Services West, and May has had various senior executive roles in Trillium Health and has spent 9 years in managerial positions with one of my favorite stores, Harry Rosen. So very excited to have her here today. And just so I don't chew up any more of her time, I am going to, with pleasure, hand it over to May.
May, I think you may be on mute potentially. May, I think you're on mute. If you could unmute yourself, May, so that we can hear you.
Okay.
We've got you now. That's much better. We can hear you loud and clear.
Thank you very much. Thank you, Tara, for that wonderful introduction. My topic today, and thank you for having me, is about healthcare data during pandemic. And this is very timely because this has just happened as we've gone through the first wave of pandemic here in Canada. And so I just wanted to talk to you about our experience and how we went through that process. During this pandemic, I was actually doing a consulting work at Joseph Brant Hospital. So Joseph Brant Hospital is actually located in Burlington, which is just west of Toronto. And the picture that you see here is our brand new wing that we opened a couple of years ago. And we have about 300 inpatient beds. And the reason I say that it's a brand new wing is because it was very timely for the pandemic. I know that many of the hospitals within Ontario and elsewhere are very old, and we did have a very old wing as well, and it would not have been suited for the pandemic that we have just gone through. It would have been very difficult for us. So we were very fortunate that we were able to have a brand new wing as we went through this pandemic. So Joseph Brant Hospital is also a member of the Burlington, Ontario Health Team. And this is important to us because the Ontario government was looking for hospitals and other healthcare providers to come together to change the way healthcare services was going to be provided to our patients and to the family. And so Burlington was very fortunate to be able to form such a healthcare team, and I will talk about that a little bit later in my slide. But that is actually one of the reasons why we went and looked at digital health and all of the different things that we did during the pandemic. Our revenue is about $214 million, and most of that comes from the government funding. So about 166, or about 77 to 78% funded through the government. So when I talk about the Burlington, Ontario Health Team, we talk about a different vision that we had. Instead of each of the providers providing separate sort of healthcare services, we were trying to come together, and the hospital being one of them. A lot of primary care physicians were there, hospice, rehab, mental health. And the idea of the Ontario Health Team is that we bring the patient to the center, and what patients had most commonly complained about was the fact that they did not know how to navigate through the system. It was a very difficult navigation as they went from one vendor to the next or one healthcare provider to the next, and they found that very difficult. So what we did was we put together the Ontario Health Team vision and putting the patient and the family at the center. So some of the things that the provincial government was expecting of us had to do with digital health. There were many things they're expecting from us from the clinical side, but I am going to really focus the presentation on the digital health side. And so when we talk about digital health, we were talking about virtual care. And, you know, if we look at today, virtual care may be sort of a common language, but it wasn't back when we started this about 2 years ago, and that really wasn't that long ago. We wanted to better connect all of our providers because each provider is an independent provider, and therefore they did not necessarily talk to each other, even though a patient may have gone from one provider to the next to the next. This may seem a little strange. I mean, I know that most industries have online booking for appointments, but healthcare is way behind in terms of having online booking appointments. So that is one of the visions of the provincial government, to be able to have online booking. We also heard from the patients themselves who have said, we want access to our own data. And if you're a healthcare provider, you actually hold that information. The patient then comes to each of the different providers to get that information, and sometimes very difficult for them. We also wanted to look at how do we analyze all of this information that we were getting, and how do we actually see each other's information, which we currently can't. And at the heart of all of that is privacy in terms of the patient and protecting that health information, so providers could not share the information. So these are some of the things that the provincial government was expecting from us in terms of our digital health platform as we were moving forward. And this was all pre-pandemic. So hospitals were collecting millions of pieces of information. You know, sometimes I think of it as data overload. There's just so much information that we have to collect and that we have to send off to the government. We at the time did not have a very robust way to look at that information. We had started to work on our dashboards, and certainly IBI and Tara has been around to help us do that. But we were sort of at the very beginning stages of that, and we really wanted to enhance our product and look at the information that we were getting, because we would have been on data overload. A lot of the information we collected was also manual, and we needed to automate that. And what we were really focused on at the time pre-pandemic was really the diagnosis. We were looking at patient types, and we were looking at postal codes because we wanted to know where the patients were coming from. And that was sort of the focus of the health information that we were looking at. And this was pre-pandemic. And so as part of the Ontario Health Team, we had a vision that we wanted to make some changes. So if you look at the left side of the slide here, we look at a bunch of providers that were all disconnected. They did not connect with each other, other than perhaps, and this may seem ancient, via fax or via telephone or some other way of connecting, but it was not electronic. What we were looking at in terms of the vision is that the patient would be able to have their health information. And this may seem like an odd concept, but if you've ever been a patient or have ever spoken to a patient, they will tell you that this is the hardest thing to get, is their own health records. The other thing that we were looking at was having the healthcare providers be able to connect to one another, so they wouldn't have to repeat tests, or they would have information at the fingertip about the patient as they were seeing that patient. Currently, you know, within the healthcare system, that hasn't happened. And then the other thing that we really wanted to share was really about, you know, our virtual healthcare, because we were not, at the time, and this was, I'm only going back maybe a year and not even a year, people didn't really think about the virtual healthcare as a way of providing healthcare, and it wasn't really mainstream. It was sort of one-off. And what we would have to do is we have to, from a data perspective, look at data sharing. We'd have to figure out how we're going to be portable in terms of transporting that information. We wanted to adhere to some very strict provincial standards because everybody was doing their own thing, and the province needed to be able to access information about the patients within Ontario at any time. So we needed some standardization, and we needed to really move quickly on virtual care. And this was all pre-pandemic. So some of the virtual offerings that we were trying to really move along in terms of virtual care was really, could we use video encounters? Like, for example, we have the OTN from Ontario Health. So there was very little uptake from our physicians on virtual care, and even our patients, because it was difficult to use. It was not easy. Most of the physicians didn't want to take a look at this. We had many sessions together about how do we get people onto OTN, how do we look at remote monitoring, etc. But like again, I said, very little uptake. The one that we had a little bit of uptake on was remote patient monitoring. So we wanted to be able to monitor patients outside of the hospital so that they would be in their home, and then we could actually monitor, say, their oxygen or how they were doing, et cetera. But also the uptake on that was very small, and the projects that we had were very, very tiny to one program. And again, online booking has been sort of a bit of a pain for us because we didn't have the technology to be able to do that. And even telephone encounters were very rare. Most of the offerings in terms of visits was actually through an actual one-on-one, person-to-person visit. So this was the problem that we were trying to solve. We also wanted to enable the patient access to digital health information. So right now, patients have to go to each of the different healthcare providers to get the information. We're looking at a way for them to look up their information, whether it be on their phone or on their computer, the ability to get their lab and DI results, which became really important during the pandemic, and then some education on how to care for certain diseases as they were at home. And these were some of the things that we were looking at even prior to the pandemic. So during the pandemic, what happened was the data demand just exploded. So it was almost overnight when we had previously, even the week before, had been trying to sell virtual visits to our physicians within our community who we had very little in terms of numbers of people showing up to actually find out how they can register, how they could get on with our virtual visits. When the pandemic actually hit, we just got exploded with, could I connect now for virtual visits? Because they couldn't see their patients. Then we were asked many questions from the government, and this had to do with our supply chain because we actually hadn't thought about not having masks or surgical gowns or shields or anything that we needed in terms of our supplies. We were asked, well, how many masks do you have on hand? We had to actually take them, lock them up, and protect the PPE that we had. Surgical gowns, we never would have thought that we would have had to pre-order any. We always had just-in-time inventory. Same with the shields. We actually didn't really need very many at the time. And then the question was being asked of us daily, how many beds can you open today? How many tests can you do today? And so that demand on us just really exploded. It was around the time of the end of February into March when this was starting to happen. It actually really took off at the first week in April. Just around Easter time, there was just a full-out, pandemic at that time, and we were trying to juggle in terms of our data Like, how were we going to answer these questions? Because we were being asked on a daily basis, how many do you have of this? Can we connect to that, et cetera, et cetera. So we had to figure out a way that we were going to be able to present this data in a timely fashion. So immediately, we had to create what we call our COVID table on our dashboard. And our dashboard is through IBI. We wanted to capture that information. We were getting asked from the government 2 times a day at the time, how much PPE did we have on hand? We always counted, from a system perspective, how much we were using, not necessarily how much we had on hand, but that was the question that was being asked of us. When we started this, we had to do a manual count because we just didn't have that information automated in order for us to provide the information to the government. And then the other thing that we were asked is, how could we forecast our supplies based on the demand that we were seeing in terms of patients coming in? How many days of supplies did we have on hand? And when would we start to run out? So this was different information than we ever had anticipated on having to answer for the government or for anybody else, at the time. So our whole focus on, looking at where patients live, what their diagnosis was, et cetera, completely changed at the time. So our focus had to immediately turn to our supply chain, getting our virtual care up. How are we going to see our patients because they couldn't come into the hospital? So I know you can't see this clearly, but this is an example of some of the things that we had built within our dashboard. And the dashboard really on the left side where the green is really talks about how many days of supplies did we have, and we had to kind of list them all out, gowns, masks, N95, et cetera. And so we could now, at the click of a finger, and going into the system, figure out and know how much supply we had at any one time. And that was a question that was always being asked of us. We also need to count the number of beds and the types of patients in our beds and how many gowns did we have left because we needed those gowns for very specific reasons. So this was what was built in order for us to be able to answer some of the questions that was asked of us on a daily basis. And again, another example of what we had to give to the government, and this is new information that we never had to give before, about the types of patients that we were having, how many times we were doing our tests, et cetera, et cetera. So we had to build this fairly quickly. It probably took us a couple of weeks to do, but we knew we had to do it because the manual count was just going to be too difficult for us to continue with. So the demand for our virtual visits, I can't tell you how that just spiked from people not wanting to do virtual visits. We couldn't have visitors in the hospitals. Physician offices were closed, but they needed to see their patients, and they had to figure out a way on how they were going to do that. We had to postpone all of our surgeries, and so we also had to keep an eye on the patients who could not have their surgeries because we could not have ambulatory care clinics, and patients could not come to the hospital for a clinic or for a checkup. If you came to the hospital, you were really very, very sick, and you were coming through the emerge at the time. Everything else was pretty well closed, and we had to make sure that our hospital was ready to accept all COVID patients. And at the time, we were looking at Italy, we were looking at New York, and seeing sort of the impact, also Spain, the impact that COVID was having at the time, and thinking that that was going to happen in Canada, and how could we prepare ourselves, which is why the hospital was pretty well emptied out in terms of patients, and we had to figure out a way that we would still be able to be in touch with our patients without having them come to the hospital. So if you look at this is pretty amazing. Our virtual care visits, remember I told you it was very slow. In 1819, we had 57. I mean, 57 is almost zero in terms of our virtual care visits. And then in 2019-20, when we started to introduce this, we had 7,631. And then as the pandemic exploded in our first quarter, We went to 11,021, and we're trending to see 44,000 virtual care visits. And as we continue going forward in the future, I do not believe that that will drop, because now we have discovered a way for to see our patients, without having them come to the hospitals. The patients do really like it, but there are going to be some cases in which there has to be a face-to-face visit, and those are the ones that will be coming back to the hospitals. We've already started to open our clinics and started to do our surgeries. But you can see that this trend just went, it just spiked in a very, very short time, because it was so difficult for us at the time to try and convince people that virtual care visits was a safe way for the patient and for the physicians to see their patients. So again, when we talked about the virtual care offers that we had and our patient access to digital health, when we look back and we do a little bit of a reflection, I think that the strategy that we had thought about in terms of trying to provide virtual care and trying to provide access digital health information to our patients is still the right one. Even after the pandemic, it has become actually more important to continue our journey of virtual care and patient access to digital health. And so we still continue on this journey. We actually have enhanced it even more today to be able to move this along much quicker than we had previously thought we could. So lessons learned, well, information is needed now. And at any time during our data collection, we could be asked for all sorts of information. Where we had put our focus before was certainly not on PPE and how much stock do we have left of this and that, but we have to learn to be far more agile, and the systems that we put in place have to be more robust in terms of being able to collect what we needed. We have to be very flexible, and we do know that virtual care is here to stay. And we actually think about virtual care, and we are planning for a 70-30 split in terms of visits. Of 70% will now be virtual versus face-to-face. So our future really talks about our patients. The patients will really be at the center, and the patient voice has gotten much louder. They want access to their information. They want to be able to, self-manage and figure out what's wrong with some help. They want to have those virtual visits. They have actually said they really enjoy the virtual visits. There is a portion of the population who like the person-to-person because it is a more social aspect for them, but overall, most of the patients do like the virtual visits, and they really want to have access to the information, which is our digital health. So our patients will drive the pace of which we will move in the future, and we do know that, and we are actually moving far faster, 10 times faster than we were prior to the pandemic. So that's my presentation for today. And at this point, I'm going to turn it back to Tara, and she's going to take you through some other stuff more technical than I can explain. And then we can do a bit of a Q&A afterwards. So Tara, over to you.
Thank you so much, May, for that thought-provoking presentation. I can tell you I was a patient in a few hospitals over the holidays and had some follow-up virtual care. And you are absolutely right. I really enjoyed not having to go into the hospital. And as a patient, I think it's here to stay. So thank you for that. Well, my job today, after spending 10 years with Information Builders, is just to give you a quick overview of what we bring to the table. And so right now, what we're finding is the biggest challenge is the data. May, in her presentation, really talked about this exponential growth in data, this desire to bring all the data together in order to get patient records easily accessible, and then the ability to disseminate that data to a multitude of patients. But it's easier said than done. As you can see in this slide, I mean, all across the globe, analysts are saying that data is still difficult to get at. It's siloed, like May said, it's in a multitude of different systems. Data is not trusted because it's growing at such an exponential rate and because of the way it's getting inputted into systems, oftentimes very manually. We just don't trust that data even though we have access to it. And then the tools are hitting the wall. If you think about 17% of people in an organization accessing data, that makes it very difficult to make evidence-based decisions. We need to get that number up to 60, 70, 80. And even better than that, we need to be able to disseminate that data outside of the hospital's walls and into the patient's hands. So if we look at the landscape, it is changing. No longer are we just looking for pretty graphs. Visualizations are only one little part of the equation. End users, they are a bit out of control. And what we mean by that is they want their data now. So they're finding a multitude of tools and ways to just quickly access that data. But it's not coming from a common area. So they're not all getting the same source of truth. Frictionless is the future, meaning we need to be able to pull information from anywhere and get the same answer. The cloud is the de facto way to operate. No longer are organizations willing to spend 80% of their budget on just the infrastructure to access all the important information they need. And data is the enabler of growth. We just talked about the way we moved from 45 visits to what will be 44,000 visits. And the way that we're going to quickly scale that is to be able to access the right information at the right time through digital transformation. So what do you need to have a fighting chance in this particular data climate, regardless of what organization you work in? You need to have trusted data. Whatever you're building, if you start with bad data, you're going to have bad results. And that seems so obvious, but oftentimes when we walk into an organization, they want to know, okay, give me the data so I can make decisions, but they don't want to look at that often labor-intensive data strategy or cleansing of data. You have to be ready to take advantage of the next opportunity as it presents itself. You don't always get warning. We've learned that with this pandemic. You have to have some predictive powers. The last presenter did a really fantastic job of just telling us about how far predictive has come and how much it is part of our everyday life without us even realizing it. We also have to make sure that we can distribute that information to whomever we need to across the organization. I said it earlier, 17% is just not enough to have lasting impact. So that's where we come in, of course, and that is that, you know, our goal from our inception was to bring data and analytics to anything, so we can embed that information anywhere so that you get it anytime you need it. And so IBI at a glance, many people have told me in the past, I've never heard of IBI. Well, IBI has actually been around for 45 years now, like since 1975. And we have done some phenomenal things in the industry over that time. We are a global company. And yes, we create and distribute our own technology. We actually pioneered 4G technology. And the whole plan back then was to be able to create that self-service, that ability to push information out to the masses. We are a leading software and analytics company, but we also heavily focus on the whole entire data management platform. So we provide a unified end-to-end data and analytics platform to help you get what you need. We have also industry-specific solutions for banking, insurance, healthcare as well. But believe it or not, many of you have probably worked with our technology embedded in one or two of your systems in the past, because we OEM our technology to lots of large organizations. And we also have many organizations white labeling our stuff and sending it out to their customers when they want to do citizen or customer facing applications. And that's why we say we have millions of customers around the globe. So some of those customers are listed here. You can see that we've got quite a few large logos, but we've also worked with several smaller locations as well. We truly can scale from a very small, in this case, since we're talking about healthcare hospital like Lennox Addington with 50 beds, to millions and millions of users at Air Canada and US Bank. So it's really been my pleasure to talk a little bit about IBI today, and it's been my honor to present with May, who is absolutely one of my favorite customers. And we'll stop there for questions.
Just waiting for James.
James, you are muted.
I was on mute. It would not be an online event if someone didn't remain on mute accidentally. So apologies for that. I was just saying thank you very much for the presentation, May, and for the insights as well, and Tara for joining us and talking a little bit about IBI and the work that you do as well. So thank you both. And audience, if you do have questions for Tara, for May, please do use that Q&A module on your screen so that we can put those. I'll be the voice of the audience, and we can put those to May and to Tara. I'm going to kick things off with a question of my own, which is, May, I know you were talking about kind of your approach to digital, your digital strategy before the pandemic. I was just wondering that now, with the benefit of hindsight, the pandemic has happened, is happening. Would you have changed your strategy for digital health in light of that?
Knowing what we know now, I actually do think the strategy that we had in place was a good one. We may have gone further in terms of speeding it up. We were trying to make sure we got the buy-in. We were trying to make sure that everybody was on board prior to, implementing anything. I think if we've learned anything, we have to move a lot faster. I mean, if you look at even the virtual care, I know people didn't want to do it, and we were trying to let them make that decision. I think we might have pushed a little bit harder, and I do think that the overall results from a patient perspective would have been better if we had actually pushed a little bit faster. We do need to connect with our providers because everybody is separate in terms of how they control that information. I think we still need to push a little bit harder on that and connect ourselves so that when the patient is sitting in front of whichever healthcare provider they're seeing at the time, they have access to that information, and not just the providers, but also the patient themselves would have access.
Absolutely, makes sense. And so if there was a second wave now, if we see a spike in cases once more, do you think that you would be better prepared now than you were obviously in the first instance? Now you've had a bit more time, as you were saying, to kind of respond and get things in place. Would you feel more prepared now?
I think we feel a lot more prepared now. Also knowing that the supply chain, which is something we had not anticipated would be such a big deal at the time. Now we know that counting what we have on hand is a very important part of the whole pandemic, not something we had anticipated at the time. I think that there are a few things that we could do better. We probably do need to even enhance our data collection and information even more. We are working on that today as we go through the process. But one thing about a pandemic is you just never know what information is going to be asked of you at any time. And so that's something that we have learned, as we've gone through the first wave, is it could be anything. And now we're anticipating what it could be so that we're not up against that. But I am sure that as we go through perhaps a second or a third wave, if that does happen, that we will be asked different questions that we haven't thought about, but we have to make sure that we're agile enough to move in that direction if we need to.
Absolutely, and I suppose that's the thing: being prepared for the unexpected. I suppose, as you say, you don't know what's going to be required in any subsequent wave, and all you can do is prepare as best you can for the unexpected. And we've got a question here from Tim Lysecki. I think I pronounced that right. Apologies, Tim, if I haven't. And Tim says, do you see data trusts playing a role in the future of healthcare so that anonymized data can be provided for research, AI projects, and other data-driven solutions?
Mm-hmm. That has been asked of us an awful lot in terms of being able to collect the data. We do anticipate that that will happen. We have to be very protective of patient information. As long as we strip that of actual patient information, but we do use it as data. I certainly believe that that would be something that would be very useful.
Absolutely, you just got to make sure that you anonymize the data, I suppose. Great, we've got another question here, which is from Carlisle Gomez. Apologies again if I've got that pronunciation wrong there. He says, could you give us a few examples of the staff roles who are benefiting from better data access? For example, a doctor uses the data for XXX, complete that sentence almost. So could you maybe give us a couple of examples there? It looks like we may have lost connection from May. It looks like she may have dropped from the line there. So while we are trying to get her back, I'm sure she's trying to dial back in furiously there. Tara, I don't know if you could maybe shed a few ideas around that one.
Yeah, absolutely. I'm happy to. So what we found in the hospitals that I've worked with, both Joseph Brandt and Markham Stouffville, where May has worked there as well, we actually were able to disseminate information to all areas of the hospital. And what I mean by that is different views for different users and leveragers of the data. So, the executive team would have a scorecard, and they'd be able to see how all the critical areas in the hospital were doing at any given time by logging in and just, seeing their KPIs presented. And then a manager would have that view plus more information, so they could drill in to see why a KPI was red or why something wasn't doing well, and then diligently take action on it. And then we also had nurses and doctors who had their own dashboard relevant to their unit that they could then make real-time decisions on. And those dashboards, unlike the other dashboards, tend to be real-time information updated every minute or two. So if you think of Humber Hospital's real-time command center, they like to call it, being able to present data in a real-time fashion where nurses and doctors could make decisions on the fly. And I see we have May back, so she may have some information.
Absolutely. Yeah, May, I do hope you can hear us okay now. If the question that Tara was just responding to there was, could you give a few examples of the staff roles who are benefiting from better data access? For example, a doctor uses the data for, XXX. So just some idea of how different members of staff in different roles would benefit from that better data access. You may be on mute. I can see that you have rejoined us, May, but we can't hear you at the moment, so you may be on mute. If not, we can go back to Tara and hopefully May. I know my team's working with May at the moment to try and resolve any issues that she's having there. So it looks like we may have her back potentially. Hi, May. Can you hear me?
I can hear you. Can you hear me?
Absolutely, yeah, we've got you back now. Thanks, May. I think we've just got a few minutes left, so if possible, we just wanted to get your opinion on this question that me and Tara were just discussing, which was just giving a few examples of different staff roles and how they can benefit from better data access. So a doctor might benefit in such and such a way, or a nurse would benefit in this way, or a manager might benefit in that way. Just some of the different roles and how they would benefit from better data access.
Mm-hmm. So a lot of our physicians are now craving the data. Whereas before they were holding on to their own data and wanting to just keep the information to themselves. Now they actually see the benefits of being able to share the data and have asked for access to all of the providers that a patient may be seeing. Because the patient, as I said before, is in the middle and they are demanding certain data elements from the providers. And this is what has shifted, I think, in during the whole pandemic and even before the pandemic started. It is that patient who is actually driving the information or the need for the information in a way that the provider had never really thought would happen. So the patient wants access to that information so they can carry it with them to take to different providers. And we've heard this from many, many patients. So now the providers are also involved in trying to get that information so that tests are not being repeated, patients don't have to come in as often, they can see their patients virtually, whereas before it was always a face-to-face, so there was really not the need to have that data. But now I think that has changed the way in which all healthcare providers, whether you're a doctor or a physician, would be able to provide access, and the patients actually really liked it.
Yeah, that's really interesting to hear that it's kind of driven from the patient side, and they're very keen for this to develop and be used more widely. So that's really interesting. Unfortunately, we have come to the end of our time together, so afraid we'll have to leave it there. But thank you, May and Tara, for joining us today and sharing your experiences. I thought it was really, really interesting. So thank you both very much.
Thank you.
Thank you. My pleasure.
And ladies and gentlemen, as I say, we are out of time for today, but thank you for joining us. And we look forward to welcoming you back again tomorrow at 2 p.m. Eastern Time for the final panel discussion of Data Champions Online Canada. And this will be one that you do not want to miss. We'll be hearing from data and analytics from Hudson's Bay Company, from Home Trust Company, and from the cooperators as well. And they will be discussing altogether the topic of delivering value from data and analytics. So obviously we've touched on that in some of the conversations we've had so far across Data Champions Online Canada, but this will be the panel discussion where we really drill down into that value piece and how you can extract value from your data, have a look for meaningful impact on your organization that comes from your data. So I think it's a really crucial element of any data analytics program that you are able to do that. I'm sure you will agree with that. I'm sure everybody would. So please do join us tomorrow at 2 p.m. Eastern for that panel discussion. I look forward to seeing you then. And until then, goodbye. Thank you.